Good evening, family and friends. Welcome to tonight's National Advocacy Summit training webinar. My name is Elridge Proctor, and I serve this community as the Senior Director of Government Affairs and Public Policy at GO2 Foundation for Lung Cancer. Tonight, I will be your presenter. But before I begin, I would like to extend greetings from Lori Fenton Ambrose, co-founder, president, and CEO, and Bonnie J. Adario, co-founder and board chair of GO2 Foundation for Lung Cancer. Joining me later in this conversation is Ted Steinberg, legislative assistant to Representative Brendan Boyle, chair of the Congressional Lung Cancer Caucus. So we've got a lot to cover tonight. And so we ask that in order for us to get through our presentation quickly, that you would take notes, jot down your questions to submit to us at the end of the call. Here's how you submit questions to us. Simply type out all of your questions to submit in the built-in question box. Any additional questions following the webinar can be emailed to us at policy@go2foundation.org. Now, just to remind you all, some of you are joining by audio, others are joining through the web, and so I will read some of the slides so that everyone gets the same presentation. As an overview, you will hear me talk about GO2 Foundation for Lung Cancer, the 2019 National Advocacy Summit and Youll meetings, roles and responsibilities of advocates and leaders, how to tell your story, and tips on how to hold a meeting. We'll go over the legislative issues and the specific ask. Then you'll get a live update from Capitol Hill from Ted Steinberg, and we'll conclude with the Q&A. To begin, about GO2 Foundation. As you all know, the Lung Cancer Alliance and Bonnie J. Adario Lung Cancer Foundation have come together as GO2 Foundation, delivering life-changing information and support services to the lung cancer community. Founded by patients and survivors, that is where our focus is and will remain. Together with you, we will break the barriers and work towards our mission, which is transforming survivorship by saving, extending, and improving the lives of those vulnerable, at risk, and diagnosed with lung cancer. The GO2 Foundation is working hard each and every day to change the reality of what it is to live with lung cancer. We're advocating to end stigma, to increase federal funding for research, advocating to ensure access to more effective treatments, preventive services, and access to high quality of care. But this work didn't just start today. This has been underway well over a decade ago. I think it's important for us to review GO2's policy impact in order for us to understand our current calls to action. So let's discuss what we've been able to do thus far as a community and together. So in 2008, the GO2 Foundation established the first ever federal research funding pipeline for lung cancer within an account referred to as the Congressionally Directed Medical Research Programs. This is administered by the Department of Defense, and this account was established directly by the Appropriations Committee in Congress. Second, GO2 secured passage of historic legislation known as the Recalcitrant Cancer Research Act of 2013, establishing a research framework that has resulted in small cell lung cancer research at the National Institute of Health and National Cancer Institute. Third, many of you are familiar with this work. Well, it took well over 10 years to successfully secure lung cancer screening as a fully covered preventive service for the millions at high risk. And now, the Women in Lung Cancer Research and Preventive Service Act was first introduced in 2016, and again in 2018, and now before us in 2019. These will help to inform where we've been, where we are, and where we're currently going. We've made progress, but I tell you, there's still so much more history to be made. We are working to bring more policy changes to improve outcomes for our community. So our call to action is to advance the Women and Lung Cancer Research and Preventive Services Act of 2019. This is known in the Senate as S 1107 and in the House as HR 2222. The second is to restore the funding level of $20 million in fiscal year 2020 appropriations for the lung cancer research program within the CDMRP. In order to advance the call to action and serve our community, we have found one of the best ways to do this is to develop and support individuals with lung cancer to become advocates. That's why we are coming together on July 21st and 23rd for a National Advocacy Summit. Embedded in the summit is a National Advocacy Day to let our voices be heard. What that day is simply about is not just a day of action, but then how strategically it helps us to make progress and to come further than where we are today. The National Advocacy Day is simply a day that guarantees the attention of members of Congress through in-person meetings and targeted messages. For individuals in Washington, D.C., you will get the opportunity to meet face-to-face with your House representative and your senators or their staffers. And meeting with their staffers is just the same as meeting with the member themselves. Individuals back at home can participate through this National Advocacy Day declaration simply by holding meetings back at home. They can attend meetings as a group or as individuals. They can make telephone calls. They can send letters through our online campaigns to encourage support. We are excited about holding the 2019 National Advocacy Summit to bring together patients, survivors, caregivers, and healthcare professionals from across the country to participate in dialogue about lung cancer research, treatment, care, in order to then take that information, bring the patient perspective and the community experiences and our values to policymakers on Capitol Hill. That is what the summit is about. If this is your first time, our goal and objective is very simple. It's learning, it's connecting, and advocating together. That's what makes us strong. If you were to ask me, what is the state of our strength? I would tell you that we are community strong. That is what we will be on July 23rd when we storm Capitol Hill. We've developed an agenda for you, but you need to have some highlights to understand just how well supported you will be on that day, and that most importantly, you're not alone. This year, we can say we have the highest number of advocates attending Capitol Hill. We have 135 or more advocates registered for the summit. We are representing more than half of the country with 30 states plus DC. And we're targeting about 170 meetings that's between House and Senate offices. Let's take a look at the agenda. I'm not going to read the whole agenda. You'll have copies of it. In addition to that, it's posted on the website. But the takeaway here is that the first day, you will connect with and support one another while engaging in the thought-provoking policy and research discussions with experts in the field. And on the second day, you have the opportunity during our congressional briefing in the morning and the advocacy meetings in the afternoon to advance lung cancer research through increased federal funding and the Women and Lung Cancer Act, as we are going to discuss. Then we will conclude the summit with a dinner at the Washington Marriott Hotel where the summit is being held. Two things I want to highlight from you is this year, we've added new features. We actually have a camp room reserved. That's for you to come and rest in between your appointments. And then secondly, I want to ask you to use our new hashtag, GO2 Summit 19. That's very important so that we bring awareness to the National Day of Advocacy. Also, another important feature that's being added this year As part of our Advocacy Day, all attendees will be able to access their schedules via mobile device at least 1 to 2 weeks before traveling to DC. Our Hill meeting schedulers, Prime Advocacy, has a mobile tool which will display the status of your meeting request, along with several other features to enhance your communication with us, to give us feedback on your meetings, as well as your experience, your overall experience on Capitol Hill. More information will be sent via email so that you can download this tool before arriving to DC. In addition, I will have Prime Advocacy to join me in making a presentation to you so that you know how to use the tool and to answer any questions about your schedules. Now, let's talk about other things that you will receive at the summit. GO2 Foundation souvenir bag and registration packet. That's a given upon registration. You're also going to get a program book that's all about the summit. We're going to provide you with fact sheets and additional materials as resources. Some of the same fact sheets and information you'll receive will also be provided in a packet for you to leave behind in your meetings. Want to also highlight that you're going to receive an advocacy fan that you can fan yourself because it is hot outside, but also a fan that you can use to take pictures with. And it simply says, "I am a lung cancer advocate." You're going to get a schedule of your appointments. This will detail your appointments for you and your state delegation. You're going to get a map of Capitol Hill to guide you. You're going to receive the GO2 Foundation folders to leave behind in your meetings. And then you're also going to be assigned an appointed state team leader to help you. Now let's talk a little bit about that. What's the role and responsibility of state team leaders? One, it's important for you to understand as a team leader, you are in charge of taking on this leadership role. However, the responsibilities are shared widely among the team. So you may want to divide the roles and duties so that everyone shares in the responsibility. Let's run through a list of simplified duties. You want to meet with your team as a delegation, lead the practice session that will be held at the summit during the state-by-state breakout. Team leaders will get to meetings on the Hill on time. You will lead the meetings and make sure to make a request of support. You will make the ask. You want to keep everyone calm and positive no matter how the meeting may be going. You can redirect the tone and demeanor by keeping everyone calm and positive. You want to take notes and answer questions. Then it's your responsibility to remind the person or to do it yourself, leave behind congressional folders. There will be one per office. And then it's important to also thank the office for taking the time to meet with you and to hear your perspectives on lung cancer. It's important to collect the business cards in order to follow up. Then you also want to take photos after each meeting, including your advocacy fan, "I am a lung cancer advocate," so that later you can post and tweet a thank you message to your member using the hashtag GO2Summit19 in your social post. And then we're going to ask you to please use your mobile tool to submit your meeting feedback to us. That's important to know in order to be able to follow up. And then at the end of each session, we will be asking you to complete our post-summit survey so that we can take in more information and more feedback from you. Now, there is also a more critical individual role and responsibility that we all must be prepared to do. And it's really simple. It's only one. Tell your story. Every individual must come armed and prepared to tell their story. I want to give you some tips on how to tell your story and how to hold your meeting. It may sound corny, but I call it the 3 Bs. Be knowledgeable, be brief and candid, be yourself. We don't want you to be anyone else but who you are. You've been through this journey and you have something to say. You have a powerful message. Here's some advocacy tips on how you go about telling your story. You want to be prepared. That's how you become knowledgeable. How do you get prepared? At home, do your research and learn the facts and issues. Practice relating your story to the lung cancer issues, research and funding for lung cancer. Dress professionally but comfortably. Make sure you're wearing the shoes that are of most comfort to you and weather appropriate clothing to keep you where you are most comfortable. Trust that you are the expert. Now let's go to advocacy tip number 2. You want to keep it local. You essentially are bringing a local impact to lung cancer. And it says a lot to your representative that you've traveled thousands of miles, you've crossed oceans and bridges to get to Washington, D.C. to come meet with them. So that's very important. You want to come into an office, identify yourself as a constituent. In large groups, state team leaders will make sure that everyone takes turns speaking. We cannot speak over one another because then you cannot be heard. Make your presentations short, to the point, and factually based. Advocacy tip number 3, simply make it personal. How do you do that? That's your story. Share your journey in telling your lung cancer story, but don't read from a script. Remember to speak from your heart, because the truth is no one can tell your story like you can. Give facts on the impact lung cancer has on you and your family or the community. Relate your points to our specific ask in order to help the legislator to understand the importance of more research dollars for lung cancer. Tip number 4, leave information and follow up. Leave behind GO2 Foundation's folders. There they'll have state facts. They'll have information that's pertinent to them and directed at their offices, if it's the House, if it's the Senate. So make sure you leave those folders behind. Take notes on what you discuss, especially if you've received an agreement to support our issues. We will need to know that so we can follow up and get the member either added on the legislation or to have Congressman Boyle working directly with them on this appropriations request. You want to thank the office and be sure to mention that you will come back and that you will be following up on support for these issues. If you tell them that you are coming back, they will pay attention and they will be sure to review the materials that you're leaving behind. In summary, I know that repetition sometimes is helpful, so I'd just like to do a quick summary of what we just talked about. So you want to tell your story. You want to speak from the heart, and you want to presume that the person knows nothing about lung cancer, so you're there to educate them. And you want to give specific examples. You want to make sure that you give them a picture of what it's like living with lung cancer. You have a side of the story to tell as the patient. You have a side of the story as a caregiver, the family and friend of that individual. You also want to be able to be direct and concise. Be clear on what exactly you're asking, and make sure that you're only making the 2 asks for lung cancer research and funding in order to keep their attention. You also want to be confident in making your request, but I caution you that it's good to be persistent, but not too aggressive in seeking their understanding. And because there can be quite a bit of people in the group, you want to take turns speaking. And I want to ask you to be attentive as to listen in the meeting as others are sharing their perspective, and also to receive the position and the feedback that the office may want to present and give to you. And then finally, as you leave behind your GO2 folders and you follow up, please remember to end the meeting on a good note, no matter how you feel the office may have received you, and to be strong about making them aware of your intentions to follow up and to continue the dialogue. This is not the one and only conversation, but many more to come. So now is a good time to transition to talk about our legislative issues. First issue I want you to know actually both of our issues fall within the House of Representatives and the Senate. One important distinction is that we work in a bicameral way and in a bipartisan way. So when you walk into an office, keep that in mind. You should either be bipartisan or nonpartisan, as to not take sides and to not give the perception that you're one way or the other. The first issue we're going to discuss is the Lung Cancer Research Program. The Lung Cancer Program, as you understand, was established back in 2008, but first funded in the fiscal year 2009 appropriations bill. As a result of the work of advocates and working directly with GO2 Foundation and our champions on Capitol Hill, lung cancer today is included within the congressionally directed medical research programs that is now administered by the Department of Defense as a result of year after year robust advocacy. To date, a total of $141.5 million have been invested from fiscal year 2009 to fiscal year 2019. This now is the second largest public or private research funding pipeline. The largest, of course, is the National Institute of Health, NCI. First funded at $20 million in fiscal year 2009 with appropriations by Congress, the program was cut back in 2010 as a result of across-the-board cuts that Congress had issued to all programs. Every year, GO2 Foundation has been working to increase that funding level. And so currently, we are funded at $14 million, and it almost feels like we're stuck there since we were funded at $14 million last year and again funded at $14 million this year in the current bill that was passed in the House of Representatives. We're calling for restoration of the $20 million in order to fund more research grants. The lung cancer program is the only program that we know with a vision to eradicate and reduce the impact of the disease. That is an important piece of information to convey to your representatives when you meet with them. The other one is to give them some bit of progress on what has happened with the funding. So to date, while the program has been underfunded for the past 10 years, it still has resulted in 250 projects thus far. The lung cancer program is actively conducting clinical trials, testing new therapies, including novel types of precision medicines for patients with specific genetic changes in their lung cancer. There is great progress and hope right now, and it is imperative that Congress restores the funding level back to $20 million. What is the ask of this funding? It's $20 million by 2020. We have a campaign with that slogan, just very simple. We want $20 million by 2020. It is important, given that the House of Representatives has just passed a minibus bill where lung cancer research is funded at $14 million, that you take this opportunity to urge all of your members to request and go to their leadership to add $20 million in the final appropriations conference bill for the lung cancer research program. This is fundamentally important because last year, we were able to secure $20 million in the House of Representatives, but did not have the $20 million in the Senate. And as a result, when the House and the Senate conferenced over the bill, we then were flat funded at the $14 million where we currently are. So the message is to ask all members to urge leadership to add $20 million in the final appropriations bill. One thing to keep in mind, the Senate has yet to approve their bill. So even now, you can add pressure and make a request for senators to add $20 million for lung cancer research within their bill, and always refer to the account CDMRP. Shifting gears a little bit, I want to make sure that everyone is aware of who the leaders are and the committees of jurisdiction. So the committee that has jurisdiction over this funding is the House Defense Appropriations Subcommittee, chaired by Representative Pete Bilowski from Indiana. And the ranking member, which is of the party in minority, is Ken Calvert from California. And the same in the Senate, Defense Appropriations Subcommittee, chaired by Senator Shelby from Alabama, and the ranking member, Dick Durbin from Illinois. Here's our talking points that in meeting with your offices you should convey, and this covers both programs. You should be sure and with confidence to mention the statistics that is well known that lung cancer is the leading cause of cancer deaths across all states, genders, and ethnic groups in the US. Veterans and women are particularly impacted. We know we have come to understand that an average of 181 women die from lung cancer in the US. That's one death every 8 seconds. That's one death too many. The disease 5-year survival rate is still a low 18%. Yet, lung cancer ranks 13 out of 18 in federal research dollars per diagnosis among cancers. It is the least funded and one of the diseases where patients are routinely blamed for their condition. This stops now because we demand better. On this viewpoint where patients are routinely blamed for their condition, it is a common view that lung cancer is self-inflicted by smoking. This has now been proven false. As we are now seeing the rates for smoking are dropping, but yet the rates for women developing lung cancer is increasing. It's not declining with the smoking rate. So we need to understand this gender gap. That's another obvious reason why research is needed on not only women, but also never smokers. And we've got a call to action to try to understand why this is happening. 2 studies I'd like to highlight that have reported higher incidence of lung cancer in women. You have the Brigham and Women's Hospital study. You also have the New England Journal of Medicine. Brigham and Women's Hospital called lung cancer a women's health imperative in a 2016 report that was an update to an earlier report called Coming Out of the Shadows. Last year, the significant finding of higher incident rates of lung cancer among women was documented in a study by the American Cancer Society and the National Cancer Institute in the New England Journal of Medicine, printed May 24, 2018. We now have a way to address this issue. It's the Women in Lung Cancer Research and Preventive Service Act of 2019. What does the act do? It requires the Secretary of Health and Human Services to conduct an interagency review to evaluate and identify opportunities for increased research on women and lung cancer, improved access to preventive services, a national public awareness and education campaign. What is the ask on this legislation? Very simple. You want to ask your House representative to co-sponsor their bill, which is HR 2222, You want to ask your senators to co-sponsor S 1107. If your members have already co-sponsored the bill, ask them to step up their efforts and become champions by urging their leadership to move the bill forward. Currently, the bill is stuck in its committee of jurisdiction. So here's the Health Committee that has jurisdiction. It's the House Committee on Energy and Commerce, chaired by Representative Frank Pallone from New Jersey and Ranking Member Greg Walden from Oregon. The committee focuses on matters pertaining to healthcare and has direct jurisdiction over lung cancer issues. In the Senate, it is the Committee on Health, Education, Labor, and Pensions, also known as HELP, chaired by Senator Lamar Alexander from Tennessee and Ranking Member Patty Murray from Washington State. Just before we get an update from Ted, I think it's important for us to just talk about the makeup of the new 116th Congress. Just want to set the stage and the tone for what you're about to hear from Ted. So the reason why you're seeing a chair and a ranking member, we talked about having a divided Congress. We have a Democratic House majority and a Republican-controlled Senate. We have a very complicated legislative process. That is why last year we were able to secure $20 million in the House, but we didn't have it in the Senate, and so we ended up flat funded. We're working through this maze of sometimes what can seem confusing, intimidating. However, I say that with tremendous hope that this can be a strong legislative year for our community. Here's what happened. In January, there were 9 new senators. We have a large pool of freshman members that have come in, and they need our education on lung cancer. So with 9 new senators, a minimum of 89 new representatives. We have a historic number of 127 women serving in Congress. Of that, they range from pediatricians to military veterans serving in Congress, the youngest and most diverse ever elected to represent their state. And let's not forget the first and only woman to hold the position of Speaker of the House. If women could help the Democrats take back the House, surely they can help to move the needle on lung cancer issues. With that, I am proud to turn it over for you to get a live update from Capitol Hill, Ted Steinberg.
Hi, hi everybody. Very excited to be here with you tonight. First things first, I just really want to thank Elridge and acknowledge her tireless advocacy here. You really have someone who is fighting for you day in, day out, and it's been a pleasure to work with. So first things first, thank you. And I also want to thank everyone here on the call. It's as someone who takes a lot of these meetings, it's really impactful to hear from the people on the ground from the district who are impacted by, in this case, lung cancer. So I want to thank you all in advance for your advocacy. It's going to make a huge difference. So I really just wanted to give a little update about where things are right now and a little bit about the strategy as we head into this advocacy day coming up next month. So I work for Congressman Brendan Boyle. He represents Philadelphia, so Pennsylvania's 2nd district. And cancer is an issue that's near and dear to Congressman Boyle's heart. It's unfortunately near and dear to too many of us. But he's excited to help lead the Lung Cancer Caucus, and he definitely does not take this responsibility lightly. So you guys are set to come to town on July 23rd. Now, the legislative calendar, just the way it's set up, the Senate will be in session. So everyone will be there. Meanwhile, on the House side, our session doesn't start until 6 p.m. So I know we have a briefing set up for you all. Unfortunately, Congressman Boyle himself will not be able to greet you. I'm looking forward to joining you all, and we can certainly find another opportunity for you to meet him. Now, a little update on the process so far. Right now, we're working on funding the government through the appropriations process. So last week, on the House side, it was a very exhausting, pretty long process. The House passed its first package of appropriations bills in terms of the different sections of the government that we have to fund. And this is all for fiscal year 20. And, on the House side, it was a pretty large package of bills that included health and human services. It included defense spending as well. We're still looking for that $20 million of funding. So unfortunately, my boss is not on the appropriations committee. There's only so much we can do. We led a letter with over 40, maybe it was 40 bipartisan members requesting that 20 million. It got bumped down to that 14, that flat level. So we're still going to push to get that 20 because this side of the appropriations process really is just the beginning. Just the way it works. The House side passes a version, the Senate side passes a version, and then they each have to come together to agree on everything, and then both houses have to pass the same version of the bill. So first things first, we definitely want to get that 20 million in the Senate version. So we're definitely going to ask for that as much as we can, but also push to get that final 20 in the conference language. Most definitely. So something that I've heard all throughout the debate process as they've been debating these bills is that regardless of what happens here, the first round, so to speak, of this appropriations process just sets up the priorities heading into conference. So if we can get it in members' minds that the priority is 20 million, I know we can get it done. So we really just have to fight for it. I actually have a call with one of the staff leads on the Senate side for the lung cancer caucus. So we're going to talk through some strategy. We're going to talk tomorrow on that. So I also wanted to update everybody on the Women in Lung Cancer Research Act of 2019. It's the bill that we introduced from our office based off of the previous versions. It's really to get a coordinated study going between different entities of the government and different agencies. It's going to be really important, and it's really crucial that it passes. So we're working on it. It did not pass in previous sessions, which is why we had to reintroduce it this session. But we're thinking if we can get enough support through co-sponsorship. Now, co-sponsorship is when a member essentially puts their name on the bill. If we can get enough members to put their name on the bill, that gives it a much easier path to pass through the House floor and then get over to the Senate. So the more support we can get, the more public support we can get, the better chances we have. So last year, I know the legislation ended with 53 total co-sponsors, and we've introduced it much earlier in the session this time around. So every session lasts 2 years. Anything that is not passed in those 2 years has to get reintroduced when Congress starts all over again in the January of an odd year. So we've introduced it nice and early, giving us a lot of time to round up support. We're already up to 20 co-sponsors this year. We just had one come in today. So if you're from California and you're represented by Representative Judy Chu, please thank her. We just got her support today. But the meetings that you'll have, a lot of it's going to be trying to get them onto this bill as well. Now, on that note, we do have some good news to report already, and that's that we submitted some report language, and that got put into provisions of the appropriations bill. So report language is important because that, while it's not law itself, it's part of the legislative history of any given piece of legislation. So when it's going through the court process, when you're looking back at the notes about what this bill means, that report language is what people see. So it's a nice win to get that language. And that about does it for my update. And again, I'm looking forward to meeting you all in about a month, and looking forward to making some nice progress on this.
Thank you, Ted. Thank you so much for this update. And also, please, before we let you go, I just have a few things I need to cover with you. Let me take this opportunity to thank you on behalf of this community for your partnership and all your hard work, and especially for the strong support of Congressman Boyle. As I know we're about to start the Q&A, we've gotten a number of questions that I just want to kickstart with you, if you don't mind.
Of course.
Let me take the leader's prerogative and ask you some of those questions. First, given that the House has passed its FY20 Defense Appropriations Bill, you said it's not a done deal, but some would like the confirmation. Is it a done deal? Can we fight for increased funding in the final package that will be conferenced later this year? And then the second piece to that is, what should advocates ask their members?
Sure. So yeah, I want to reiterate that it's never a done deal until that bill passes. And even then we can still try to work with it, but it's definitely not a done deal at this point. We've talked about it a little bit, mentioning that last year the changes happened in this conference committee. So after each individual chamber of Congress, the House and the Senate, passed their own version of appropriations, they come together and compromise on a version, and that's when they can make a lot of changes. So there's no reason that can't happen again, except this time the change can be in our favor. So I think the advocacy of last year definitely boosts our chances of this year. So we just have to keep fighting, and that's why it's really a good, important ask as we head to that advocacy day. And in terms of what advocates should ask their members, it's going to be to stress that $20 million for lung cancer research, but then also to sign on to this bill. Absolutely.
Okay, great. The second question is, I know that so this one is a little bit mixy, but let me just say, I understand it. As a current legislative staffer, what message or types of information would you like to hear from a constituent in order to advise the member to support the issue? Now, I can tell you, Ted, as a former Capitol Hill staffer, I was always most interested in hearing testimonials from patients to try to understand what it's like to live with their condition. So in your own words, if you could put words in their mouths, what's the key message or point that you think an advocate ought to make to their office?
Well, I would absolutely share personal stories. Just in terms of stories, statistics, those typically get used for the best speeches. So giving your office some helpful points to discuss as they continue to push for funding is going to be really helpful. And that's where stories and statistics make the most sense. You're pretty spot on with your advocacy tips. You do want to keep it local. All politics is local, and these members are there to represent you in their districts. So if they see the impact it has on their community, they're going to be that much more motivated to act and represent you. But definitely focus on what still needs to be done as we fight lung cancer. There are so many questions that we still have. We need funding to get those answers. So I think if you can put it in those simple terms, and then be sure to stress your personal experiences, I think that'd be very powerful.
Thank you for that. So now I've got a question of my own. Last week, I heard from Majority Leader Steny Hoyer's Senior Policy Advisor that under the Democratic control, the House is following regular order in terms of requiring that all bills go through the committee process and get scored by CBO before it can pass the House. Does this impact our strategy to increase the co-sponsorship of our bill and seek consideration from leadership by the end of the year?
So I actually don't think this changes our strategy much. We definitely want to show that our bill has as much widespread support as possible. And not to get too into the weeds of a complicated legislative process, but I actually think the ideal situation is if we pass this under the suspension of the rules, which allows for an expedited process, but only if there's 2/3 of the House that would support it. So if we can show that we have enough support, I do think we'd be able to work our way through leadership and actually push the bill through. So I don't think it changes our strategy all that much. The more support, the better in almost any situation.
Okay, and forgive me, I'm going to push the button a little bit on this one. So last year we ended co-sponsorship at 53. What would you say is the right number of co-sponsors that we should seek to get on our Hill Day or overall by the end of the year?
Sure. So we're at 20 right now. Granted, we have a little bit more time in the process, but we're definitely going to look to see who sponsored the bill last year that isn't on it again this year, because those should be relatively easy to get. We'll definitely want to get into the upper 30s or low 40s a couple weeks after the visit. Have the visit, maybe have 10 or so come in the day of or the days right after the visit, just as momentum is high. And then hopefully as other offices continue to look at the materials, after advocates follow up with these offices, that will likely trigger a couple more. So I think we definitely want to start getting into the 40s, and that would, once members start to see there's a lot of support behind it, it makes it that much easier to support because they think it has the opportunity to pass. So good, strong advocacy that can get us another 10, 20 co-sponsors, that would push to get an even higher number. So I think if we can have that goal, the rest will kind of propel itself forward.
Okay, great. So given the House is under Democratic control, would you still encourage advocates to bring on as many Republicans as Democrats onto the bill as co-sponsors?
Absolutely, and absolutely for a couple of reasons. One, we want just as much support as we can get. This is an issue that affects everybody. Disease doesn't care if you're a Democrat or Republican. We want everybody to be in this together on this fight. But also, if we want it to pass the Senate, we have to show it's not just a Democrat issue as well. As you mentioned earlier, the Senate's controlled by Republicans. So we want this to be a real act of Congress that the whole legislature can get behind.
Well, we've certainly taken enough of your time, Ted. I thank you so much for just being with us and answering these questions. I'm going to continue to answer questions that have come in. You're welcome to, I know that you've got to run for votes. I forgot you told me that there's rounds of votes about to start for you and the member, but you're welcome to stay on and drop when you have to, but thank you.
Yeah, absolutely. And thank you all again. Looking forward to meeting you all. And I really do just want to thank you again for your advocacy and for continuing this fight. We're in this together, and I'm looking forward to helping make some change here. So signing off for now, but looking forward to next month. So thank you again.
Thank you. We'll be seeing you. So a question we've received, a number of you are asking if we can share the slides. Yes, we will definitely send that to you via email along with the link to this recording. In addition to that, I will also provide you the mobile tool information and instructions from Prime Advocacy. Another question we got is, with the full 20 million, what will that accomplish as opposed to the 14 million? So in other words, the more money we have, the more grants we can fund, so more research will be conducted on lung cancer. The less money we have, the fewer grants we can fund, so less effort, less work being done in lung cancer. That's the answer to that question. Someone is asking if the Senate is not in session, when we're on the Hill, will the senators and their staff be available to meet with us? Yes, and it's actually the opposite. So it isn't that Congress is adjourned. The House comes into session after 6 p.m. on the 23rd. The Senate will be in active session. And so what that means, it changes around your schedules. One of the things we try to do is be as thoughtful about where people are in their journey. Some of you will be coming here and you're on active treatments. Others will be well-to-do in terms of being able to walk and get from meetings to meetings. Others will only be able to handle the minimum of 3. And so in trying to accommodate everyone as a group, we try to schedule your meetings so that you're not going back and forth. But in a situation like this, where you have a split Congress, the House is not in, the Senate is in, you may have to start your meetings in the Senate and then come back to meet with your representatives in the House. I know that in scheduling the meetings, that some members are beginning to arrive in the hours of 3 and 4 p.m. And so some of them will be trying to accommodate your schedules to come meet with you. Others simply may not arrive until 6 o'clock, just in time to go cast the first vote. And so we'll work that out through the schedules. We ask that you remain flexible and also to have your understanding as we try to schedule the best day possible for everyone. Another question is, do you have to co-sponsor the bill if you're, so co-sponsoring does not have to come from committee members. It would be wonderful if we can get as many committee members onto the legislation as possible, because essentially they are showing support to a bill that they have jurisdiction over. However, to achieve our goal of having 40 or more total co-sponsors, we want all members to co-sponsor the bill. And I think what's the important point is having it to be bipartisan. When a bill is co-sponsored by both sides of the aisle, it really shows great strength in the bill. And again, good traction for passage. Somebody's asking, can we see a list of all who has already signed on to the bill? Yes, if you go to our website, there's a wealth of information. And we have a web page that is dedicated simply to the legislation titled Save Her Lungs. We've launched a campaign around this issue. We also provide the most up-to-date list of co-sponsors there. We also have another campaign dedicated to the funding titled 20 Million by 2020 campaign. I'll show you images of those in a little bit, but essentially, you can go there and you'll be able to access information about that online. The other thing too that I want to bring up to you is somebody asked about seeing who all is on the caucus list. We also have a web page that's titled to the Congressional Lung Cancer Caucus, and we want to be able to show you who the members of the caucus is, so that as you're meeting with them, you can thank them for their support already, or you can ask them to join the caucus. But right now, for this year, our main focus is on the funding because time is of the essence, and then the legislation. We're on a web, we've just gone over to the next slide. Wanted to show you all what some of these campaigns that I was talking about. So for our National Advocacy Day of Action, we really are asking everyone to, whether you're coming to DC or virtually participating, you want to get to your members of Congress. And if you go to the Action Center, for those back at home, they have a way that they too can support your mission and demand a 20 million by 2020 for lung cancer research. They also can advocate for the Women in Lung Cancer Research and Preventive Services Act. And again, and to keep the national dialogue going, we're asking you to please use the hashtags either Save Her Lungs or GO2 Summit 19 on your social media. You can also tweet your members and any other message that you want to share, you want to thank them. These are all great ways to get to them and to acknowledge the mission that you're on, which is an education mission and a support mission for lung cancer, for the lung cancer community. With that, I'm going to conclude our Q&A out of respect for everyone's time. A lot of the questions we've received are a bit repetitive in terms of asking the same types of questions. And I think some of you are telling us that you're getting the confirmation on what you were asking. So we will be sending an email with more specifics about some of these issues. And some people are just asking, like, how do we find which offices we will visit? All of that will be on your schedule. And so we'll provide more information via email, and we'll talk through it with you during the in-person session at the summit. If you find that you have a question that did not get answered, you can email us individually, or you can feel free to give me a call, and I will take the time to talk with you and walk through anything that you weren't sure about. So again, thank you everyone for just taking the time out of your busy schedules, taking time away from eating dinner, putting your kids to bed, just all of the things that you have to juggle in addition to lung cancer. Thank you for just joining us and for this great dialogue tonight, and I look forward to staying in touch with you. Immediately following this webinar, you will be directed to take our post-webinar survey. Again, give us your feedback and feel free to present any further questions to us. With that, I bid you a good night and a thank you.